please stand and say the pledge. And say a prayer. You can say a prayer.
I will.
All right, Rick, right? Yes, sir.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Bow our heads, please. Most gracious Heavenly Father, we do thank you for this day, Father, for such a beautiful day. And Father, just go with us now as we go into this commissioner's meeting, Heavenly Father, that everything we say and do is to please you, Heavenly Father, and do what's best for our county. And go with us now, lead, guide, direct us in everything we say and do. Forgive us in Jesus' name. Amen.
Everybody had a chance to review the minutes and claims? Yes, sir. Any questions?
I'll make a motion to approve.
Todd made a motion.
I'll second that.
Rick second. All in favor, say aye.
Aye.
Aye. Josh?
Yeah,
Nice.
I'm older brother.
Zach? The other one?
Yeah.
Sorry about that.
That's all right. I've had that all my life.
Told you I'm old.
My mother would go through all the Josh, Chad, and then Zach, so he gets my name on the truck.
I don't want to go there. I'd like to get out of this. I'm having blunder.
My dad just had to run through all three.
Have a George Foreman with it.
Thanks, sir.
You guys, sir.
Thank you.
So take it back.
There you go. Thank you.
All right. So what I just passed out to you guys is basically all the quotes that I ran for you guys on the medical insurance for the county. As we know, Humana is leaving the group space. They're going to still do the ancillary lines of life, dental, vision, but on the group medical, they are leaving. So what I did is kind of jumping the gun and quoted this out, because you have Humana insurance all the way to 1/1 if you wanted to. So I started looking into just where the rates were with the other carriers, got all the information, sent it to them, and we've got some good results. First, there in the second column is Allstate benefits. They came in really good. What they are is a level funded plan. It's not a self-funded plan, what the county had done previously in years past. The benefit of a level funded is they do take into account how healthy the group is. So I had to get a large member blind. It's all blinded, so I don't see what member it is. But I got a report, and you guys overall are really healthy right now. And that goes really well for these type of plans. And even in large group, they do kind of base somewhat of the rates with Anthem and United to the right there, based off that. So Allstate, what they came in, overall, plan designs are very, very similar to what you have. Combined percentage off because it would still have the two plan options, would be 4.2% less than what you're paying now. So that was lower than what you got right now, so there was some savings. Anthem, the kind of that pink shaded columns there, there's the two plan designs. They match very, very, very close to what you have now. There are some additional benefits you would pick up, like the telemedicine, which is becoming a bigger thing when you're sick. I just used the telehealth for poison, or my wife had poison ivy, called this telehealth. They sent in prednisone to the nearest pharmacy and it was picked up. It was very easy. You know, when you're sick, strep throat, I used it on that before, and it just makes things a lot easier. You don't have to go to the doctor.
The minor stuff.
Yeah, minor stuff, yes.
Right.
But yeah, so Anthem, they came in really, really well with you guys. They are a combined percent off of 12.49%. I thought we were going to be right around the 16%, but I was talking about how healthy you guys were. You know, I did knock on wood, I don't think, that at that point. And the largest, I guess the blinded members, large claim came in, and the high cost member report showed a total paid amount of $278,000 on one member a couple months back. So that kind of decreased the savings a little bit there. But you're still looking at a 12.49% decrease in rates. And this would save approximately, enrollment always changes, members come on, come off. But that looks like about $129,000 in savings for the county on the medical insurance. This was a proposal for an effective date of 9/1. So you would have plenty of time. If this is something that you guys want to move forward with, I would get with Cheryl and Kyra, and we would get the open enrollment. One question that always comes up when you move off cycle like this is how's the deductibles and out of pocket for your current plan year. And all of that would be credited. So if somebody's already reached the deductible with the Humana plan, it gets credited right to the Anthem plan. So these plans match up very well, and everything gets credited. So if you hit your out-of-pocket max, it carries over.
So you could start that in September.
Yes, 9/1. Yeah. And the thing is they do account for health of the group, and so you know. That latest report that I got, if we have another 250,000 on the next one, your rates are not changed, you know. So it's one of those things you can take advantage of, or you can go all the way to 1/1. We can quote this all out, but these aren't the numbers that you're going to get.
Okay.
Kind of my November time frame, December.
Any question?
Go ahead, man.
Zach, we appreciate it.
Yeah, if you want to decide on, think about it, decide on that, and then it's got one written out, it's all set.
Okay.
Yeah.
Appreciate it.
Yep.
Thank you, Zach.
You're welcome.
Make a decision next meeting.
Yeah.
We'll go with this stuff.
Yeah. I will be out of town next meeting, but if you were going to make a decision on that, you can give me the word, and we'll get it rolling. Sooner the better, obviously, to get Cheryl and Kyra all squared away, and then reaching out to all the employees.
So we would still be safe at the first meeting in August.
Yeah, and what I would do is I'd have projected probably open enrollment period the first 2 weeks in August, and that knocks that out, and then we have the following 2 weeks to get everything squared away on the back end to get having 9/1. Yep.
Thank you.
All right, thank you.
Thanks, Doug.
Health Department, Maggie? How are you this morning?
I'm good.
Morning.
I just brought one of these for now. They were sent from the state. It's a workforce assessment that all 92 counties had to do on, like, what everybody's paid at and everything for the health departments. It's just a breakdown.
For your information, right?
Yes, yeah. Yeah, we had to do a survey, was it end of last fall? And we got $1,000 for participating in this survey that we had to do. So we had to meet certain requirements on it.
Good deal.
But that's for the governor's public health, like that workforce kind of helps with it. Like you said, Phil, you just wanted me back to talk about the Governor's Public Health Commission. I had heard that, I haven't seen it written on paper yet, but I had heard that it's not going to be called Governor's Public Health Commission anymore. It's going to be called Health First. But like I said, I've not seen that written anywhere. They changed it in case they changed the name in case the governor doesn't get reelected. Then it doesn't fall back into a new governor's lap, and then they kind of ex-nay the funding. So that's why it's changed. But the governor's public health, I've said before, we're looking at $306,000 for next year. That's minimum amount. We might get more if counties don't participate in it, then our funding could go up.
I think I read where there's 38 counties so far. We'll find a little bit more out today from other counties around us. And then we've got that video on the 11th.
And I still haven't got the link for that. You've not sent it yet.
You know?
You've not sent it to me. You called me the other day, said you were going to forward me the email, and I've not got it yet. I've emailed you about our board meeting next week and told you the date and the time, but I've not heard back from you on the link.
I will get that to you.
Okay. And then I can send that on to the board, so the sooner I can get it, the sooner I can tell them to see if they have time to watch it. But again, with this funding, we're required to do certain goals. It's called key performance indicators. We have to meet certain levels. Within that, we have to have positions hired for them. Not that we have to hire first of the year. It may be mid-year that we actually start hiring because we have to, of course, interview and publicize for it. But one will be like one that we're looking for 2024. We don't have to hire everybody, but in 2024, we're looking at hiring the school health nurse liaison, someone to do lead risk assessments, and we're hiring an environmentalist that will be our lead risk assessor, but they will also help assist Chris Bowling with like mosquito, well, not necessarily mosquito, but like septic complaints and issuing septic permits, housing complaints, anything along that lines. And then we're looking at hiring a part-time vector control person just to work from, say, 1st of April to 1st of October, mid-October, to help keep the mosquito population down within our community.
And you said you talked to Bill about your office area, so we're okay on that part?
He said he can make anything work on space. In 2021, we had got a lot of laptops, so they're pretty much brand new, but we had those for the fact of our COVID clinic. So we will not have to buy computers at the moment. They can work off of laptops. He can make them hook up to our printers, and they can print everything. It's just getting a desk for them and or dividers to kind of divide their space off. But yeah, we can make the space work, he said.
Out of the 311,000, or 306,000, 306,000 the first year, what will your plan be for the 306,000?
So again, right now, the funding, we have funding through this money already, but it funds our part-time nurse. So her position will already still be in this funding. She gets a FICA and Social Security, all that comes out. So it would be her salary, a part-time salary, again, Social Security, a full-time environmentalist that would do the lead risk, that would meet one of our goals, and then to hire a full-time school health nurse liaison. and they can help both of our nurses do different things in our clinic. So that would be 4 positions. We're, with this funding we already have, it's just getting bigger. We buy soap for our hand washing units. We're looking at buying new hand sanitizer stands for our events. We're doing a sharps disposal. So say you have a diabetic that needs to throw away their needles, we would have a pickup. It's called a specific waste disposal. They would come pick up the sharp box, and we pay the monthly service of picking up, but we also provide new boxes for people to come in.
Right.
That's just some of them. Billboard ads, we're looking at trying to advertise the health department a lot more. We do smoking cessation already. We will have a bigger line item for Use Your Health Pack. They put it in articles in the paper, but it says sponsored by the health department or provided by mosquito control. When we have a vector control person, we're going to have to buy new equipment because ours is starting to get outdated and not running as properly, and then we'll have an abundance of mosquito control spray, since we'll have a dedicated person to that. I can look at my list. I'm working on the budget still. I'm not got it finalized yet because I'm still working on the salary line items. We will have like education in this too. So we'll have money set aside for the staff to go to trainings. We'll have cell phone reimbursement because the county we already have cell phone reimbursement in the health department. So we'll have that as well for this new funding for the new staff. We'll provide insurance through that money. So whatever insurance company you guys go after, this funding will help offset insurance for the new employees. So it won't be coming out of the county's budget. We'll still be on y'all's plan,
Right.
since we're paying for it. And then we can provide longevity. Anything that the county already has, the state says we can provide it through this funding for our new staff. But that money goes quicker than what you would think.
So the second year,
The second year, we're looking at around, I think it's 608,000 minimum.
I think it's 7, isn't it?
No, it, minimum is 612. The maximum was 817.
But
So,
that's based on numbers today, right?
yeah,
So right
It can
now,
change.
there's 38 that signed up.
yeah,
So if no more signs up, we know it will be that amount,
yeah, we know the base amount we're getting,
right?
but it could change, and we could get an additional amount of money to
Right.
support more stuff to go on.
And I think it might grow.
Yes, and we're just starting a little bit in 2024. They know we don't have the money to do everything, so in 2025 we'll expand and go from there. But for now, this is where we're wanting to start at and just build upon. And if we don't use all the money at the end of the year, it does revert back into this line item for the health department.
Right.
So it just stays with us, and then say in 2025, well, say in 2024, we only spend 150,000. In 2025, we get the 612, and we want to spend an additional 150. It's called a carryover. We can request that carryover, and we can have a bigger year on top of it.
So the health department should grow
Should grow,
and be better.
yes. Right now, we only have a staff of 5 full-time and 2 part-time, and we're looking to grow it, at least double it with staff, so.
And I think the deadline on this is September
1st. September 1st,
20. Is it 1st?
yes.
Okay.
So the commissioners have till September 1st to decide, the sooner the better, and then the health department, on my end, I have by September 1st to submit our budget, which I'm getting closer. Our health board meeting will be next Wednesday, so I will be discussing the budget with them, tell them the breakdown of it, they'll see it too. They'll approve it within our minutes if they decide to go for it. If they do, then I'll come back the following week. I believe you guys have a meeting on the 18th, and I'll bring it for you guys, and then you guys will just make that decision within one of your meetings. And then when you do that, there's a link on your email. You'll just upload your minutes that says that you guys made the motion to approve the health department accepting this funding.
Okay.
For the council, the minimum they have to do for the first year is have a 3-year average of the health department's budget. And we already will meet that as long as they stay status quo for the health department this year. 2025, the base minimum is 20,000 they have to put forward. But the state is telling the counties not to just put 20% in. They're wanting the health department to stay the same because if that funding was to get cut, you don't want to, the health department staff that's already there, you don't want them to not have a position to come back and fill the basic needs of the health department.
Just clarification, your address, Peggy, hasn't changed or anything, has it?
My what?
Your address,
My
email?
email? No.
I just sent it to you again, so,
Okay. Yeah, it's not changed.
okay.
But I did, like I said, email you on the date for next week.
We got July 11th, 10:30 to 11:30
Yeah, that's the webinar. And
webinar,
the 12th is at 4.
right, and your meeting's on the 12th
Yes.
at 4, and that's at the government building.
Yes. I'll see if the extension office doesn't have the conference room reserved. If they don't, then we'll meet in there. If they do, we'll meet in the nurses' clinic room.
Okay, let me ask right now, you want us in there, we need to advertise time on the 12th.
Yeah.
Can you advertise for us so we're legal? Okay,
And then I'll have my agenda posted too that says that we're discussing this at our
Okay.
meeting.
when you get back, check your email, make sure you got this,
I can sit back here and look at my phone
Okay.
and get on it. But
check, make sure you got it.
yeah, but by the time you guys are done, I can.
It's got the link.
Okay. Do you guys have any questions on this funding? Like, it's kind of all new to us, and they said that the 92 counties will all be figuring this out together. So they said anything will work as long as it meets our goals.
Maggie, what happens 2-3 years down the road, the state decides they don't want to
So,
fund this anymore? What happens to
yeah,
people you've hired and
they,
programs and so on and so forth?
our part-time nurse already knows going into it every year. Okay, right now, we have at least 92,000 sitting in that fund. She knows that that 92,000 fizzles out at the end of the year. We spent it all, which we don't because right now, we just don't have much to deal with. But if that money runs out, it's considered like a grant, but it's not written as a grant wise. Her positions just won't be there. So the county just doesn't fund it. She goes, no, right now anyways. It would be the same way with the new employees coming in. If that money dries out, you guys won't have that responsibility. So that's why they want the health department staff that you guys already paid for stay the same. In case that money was to go, then you already have the main ones that are required for the health department. So, yeah, you just gotta consider it like a grant, and our grants run out. So it's like, if that position's not there, it's just not there. And we have to tell them going into it, that money's not there, we're sorry, you just won't be there the next year.
No, I'm good.
Hey, Maggie,
Okay, you're welcome.
check that, make sure you got it.
Yeah, I'll check it back here and I'll let you know when you guys are done.
Okay,
Okay?
thank you.
You're welcome.
Tammy, you have anything? No? Rick? You have anything?
Yeah, a little bit.
Oh.
Nothing too bad. We had quite a bit of storm damage from the weekend storm that passed through there. Had several call-outs. I think we pretty well got it under control. Once we're done paving, we might go back through and kind of dress things up a little bit. Everything's open for now. The bridge beams are due to be delivered to Blue River Road today. I'm guessing in 2 weeks before the project completion, hopefully. Asphalt's currently holding at $75 a ton. Today, we're paving the south end of Mountain Road in Gibson Township. If all goes smoothly, this morning, we're headed to Quarry Road this afternoon to skip patch over an area there that's getting pretty bad. And that'll be a temporary fix until Highway 56 is opened back up. I met with Duke Energy last week on Mount Eden Road. They have a big power line project down there and it tore up some of our road. And they've agreed to pay to have that dug out and repaved. So it won't be an expense to us on that. And at the next meeting, we'll have a bid opening. And I think that's about all my news.
And that will be first thing on the agenda.
Yeah.
Yeah.
That's all I've got unless you got questions. We're trying to do a little mowing, a little spraying as we get time.
Questions?
No, sir.
No.
Thank you.
Thanks.
Justin?
Howard? President?
No.
Your meeting went all smooth the other day?
Well, it went pretty smooth, yeah. We tabled a few things, but, yeah.
Okay. That being said,
There was one other item on the agenda, PTBOA appointment.
oh, we are going to table that, so maybe we'll share it again. I'm sorry. I need a motion for adjournment.
So moved.
Second.
Rick in motion, Todd second, all in favor say aye.
Aye.
Aye. Thank you.
I got it.
Got it?
Yep.
Everything there?
Okay.
Anything, let me know.
Okay, thank you.
Thank you.